Good day, my fellow educators, especially to our professor, Dr. Manuel Roman. I am Vernalisa P. Espartero, your presenter on this topic. We will be discussing on the emotional and behavioral disorder or EBD. Let us begin. The history of EBD. The term emotional disturbance was first developed by Eli Mike Bauer in the 1960s. Bauer did a research on identifying students who needed services because of severe emotional and behavioral problems. The mainstreaming of exceptional children in the classroom was one of the Bauer's primary interests. Based on the several studies, a child with emotional and behavioral disorder will be determined if, first, there is a condition of exhibiting one or more of the following characteristics over a long period of time that affect educational performance. There is also a condition in which emotional responses of an individual are different from generally accepted norms. A child has inability to learn intellectually, sensory, or health factors. Inability to build or maintain interpersonal with peers and teachers. He or she also displays inappropriate behavior or feelings with pervasive mood of happiness or depression. Or a child has developed physical symptoms or fears. In general, there are several ways to identify a student with EBD. Some students would manifest multiple measures of behavioral, social, and academic. It could be determined through interest in studies, performance in classroom activities, participation in extracurricular activities, punctuality to school, paying attention in class, or avoiding company. Checklists, rating scale documentation that behavior occurred over a long period of time that affects academic performance and inappropriate classroom discipline or instruction. What are the characteristics of EBD? A specific diagnosis where the child displays persistent and severe behaviors, social, emotional, and behavioral difficulties, has symptoms like disruptive, antisocial, and aggressive behavior, poor peer and family relationships, and hyperactivity, attention, and concentration problems. What are the different types of EBD? First in the list is adjustment disorder. Are excessive reactions to stress that involve negative thoughts, strong emotions, and changes in behavior. One may have witnessed a stressful event or had a big change in their normal lifestyle. This could then have an adverse reaction on their behavior, and the child may become prone to truancy, vandalism, or fighting. The types of stress that can trigger an adjustment disorder or stress response includes the ending of a relationship or a marriage, death of a loved one, being a victim of crime, having an accident, undergoing a major life change, such as getting married, having a baby, or retiring from a job, and living through a disaster, such as a fire, flood, or typhoon. Second is anxiety disorder. Anxiety disorder is a common mental illness defined by feelings of uneasiness, worry, and fear. Anxiety makes it difficult to get through your day. Symptoms include feelings of nervousness, panic, and fear, as well as sweating and a rapid heartbeat. Third is obsessive compulsive disorder or OCD. It is a mental illness that causes repeated unwanted thoughts or sensations or obsessions. It also can give you an urge to do something over and over again or compulsions. A compulsive habit might be to wash your hands 7 times after touching something that could be dirty. Although you may not want to think or do these things, you feel like you can stop. Everyone has habits or thoughts that repeat sometimes. People with OCD have thoughts or actions that take up at least an hour a day, or those who are beyond control. The fourth type of EBD is attention deficit hyperactivity disorder. It is marked by an ongoing pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. Inattention means a person may have difficulty staying on task, sustaining focus, and staying organized, and these problems are not due to defiance or lack of comprehension. Hyperactivity means is when a person may seem to move about constantly, including in situations when it is not appropriate or excessively fidgets, taps, or talks. In adults, hyperactivity may mean extreme restlessness or talking too much. Impulsivity happens when a person may act without thinking or have difficulty with self-control. Impulsivity could also include a desire for immediate rewards or the inability to delay gratification. An impulsive person may interrupt others or make important decisions without considering the long-term consequences. Fifth is oppositional defiant disorder or ODD. Is a behavior condition in which your child displays a continuing pattern of uncooperative, defiant, and sometimes hostile behavior toward people in authority. This behavior often disrupts your child's normal daily functioning, including relationships and activities within their family and at school. It's common for children, especially those 2 to 3 years old and in their early teens, to be oppositional or defiant of authority once in a while. They might express their defiance by arguing, disobeying, or talking back to adults, including their parents or teachers. When this behavior lasts longer than 6 months and goes beyond what's useful for your child's age, it might suggest that they have ODD. Sixth is post-traumatic stress disorder or PTSD. It's a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. It is natural to feel afraid during and after a traumatic situation. Fear is a part of the body's fight or flight response, which helps us avoid or respond to potential danger. People may experience a range of reactions after trauma, and most people recover from initial symptoms over time. Those who continue to experience problems may be diagnosed with PTSD. 7 is conduct disorder. It is a serious behavioral and emotional disorder that can occur in children and teens. A child with this disorder may display a pattern of disruptive and violent behavior and have problems following rules. It is not uncommon for children and teens to have behavioral related problems at some time during their development. However, the behavior is considered to be a conduct disorder when it is long-lasting and when it violates the rights of others, goes against accepted norms of behavior, and disrupts the child or family's everyday life. Symptoms of conduct disorder vary depending on the age of the child and whether the disorder is mild, moderate, or severe. In general, symptoms of conduct disorder fall into four general categories. The four general categories of conduct disorder. First, aggressive behavior. These are behaviors that threaten or cause physical harm and may include fighting, bullying, being cruel to other animals, or using weapons and forcing another into sexual activity. Second is destructive behavior. This involves intentional destruction of property such as arson or deliberate fire setting and vandalism or harming another person's property. Third, deceitful behavior. This may include repeated lying, shoplifting, or breaking into homes or cars in order to steal. Fourth is violation of rules. This involves going against accepted rules of society or engaging in behavior that is not appropriate for the person's age. These behaviors may include running away, skipping school, playing pranks, or being sexually active at a very young age. 8 is anorexia. Anorexia is an eating disorder that causes people to weigh less than is considered healthy for their age and height, usually by excessive weight loss. People with this disorder may have an intense fear of weight gain. Even when they are underweight, they may diet, exercise too much, or use other ways to lose weight. The exact causes of anorexia are not known. Many factors may be involved. Genes and hormones may play a role. Social attitudes that promote very thin body types may also be involved. Risk factors for anorexia include being more worried about or paying more attention to weight and body shape, having an anxiety disorder as a child, or having a negative self-image, or having eating problems during infancy or early childhood, or maybe having certain social or cultural ideas about health and beauty, and trying to be perfect or overly focused on rules. Anorexia often begins during the preteen or teen years or young adulthood. It is more common in females but may also be seen in males. 9 is bipolar disorder. Bipolar disorder is a brain disorder that causes changes in a person's mood, energy, and ability to function. People with bipolar disorder experience intense emotional states that typically occur during distinct periods of days to weeks, called mood episodes. These mood episodes are categorized as manic, hypomanic, or abnormally happy or irritable mood, or depressive, sad mood. People with bipolar disorder generally have periods of neutral mood as well. When treated, people with bipolar disorder can lead full and productive lives. 10 is schizophrenia. It's a chronic, severe mental disorder that affects the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. People with schizophrenia often have problems doing well in society, at work, at school, and in relationships. They might feel frightened and withdrawn, and could appear to have lost touch with reality. This lifelong disease can't be cured but can be controlled with proper treatment. Schizophrenia involves a psychosis, a type of mental illness in which a person can tell what's real from what's imagined. At times, people with psychotic disorders lose touch with reality. The world may seem like a jumble of confusing thoughts, images, and sounds. We have 5 tips for handling EBD kids in an inclusive classroom. First, keep class rules activities simple and clear. Let students know about them on the first day of class and post them in the classroom as well. An example list might be on time, try your best, be polite, and respect one another. By including clear activities in your classroom, your students will engage and interact with the lesson plan, ensuring that they learn alongside other students. Second is reward positive behaviors. Try to celebrate the successes of the students more than you reprimand or punish their mistakes. When they receive positive feedback and rewards, they start to see that there is a positive benefit to good behavior. They will then start to see you as more of an ally than an adversary, and this will in turn motivate them to want to behave and do well in your classroom. Third is allow for mini breaks. A lot of EVD kids lack the emotional balance and maturity needed to remain focused and on task for long periods. Instead of reprimanding these students for their lapses, build in short rest periods or mini breaks into the school day. Take time to periodically stop teaching and allow students to catch up if need be. Give them time to finish their assignment and allow those who have finished to stretch, get out of their seats, and move around a bit. This will allow them to burn off any excess energy that might have built up from sitting still for a long period of time. Fourth is fair treatment for all. Students with emotional and behavioral disorders also often don't respond very well to situations that appear unfair to them. This can trigger a cascade of negative emotions and acting out behavior. To ensure that you are treating all of your students in a consistently fair manner, don't bend your established rules for any student. Enforce the expected consequences every time with every student. Allowing exemptions opens you up to accusations of being unfair. Fifth is use motivational strategies. To avoid disrupted or off-task behaviors, take some extra steps to motivate these students. Offer them incentives for academic successes, large and small. Celebrate their hard work and praise their good efforts consistently. This can go a long way in giving the students the motivation to excel in your class. While having EBD kids in your classroom can at first seem daunting, these are proven ways to help cultivate and keep a harmonious spirit of learning. The intervention for EBD. People with emotional behavior disorder or EBD need comfortable environment with family, peers, and extra family support, love, and care. My references. Thank you so much for watching my presentation.